Hello, welcome to your online lecture for the course Pathophysiology. In today's lecture, we're covering stress and disease. So let's go through a few key terms before we move on with today's lecture. Stress can be broadly defined as a perceived or even anticipated threat that disrupts a person's well-being or even disrupts what you would know of as their homeostasis. Stress involves a complex interaction between the body and the brain in the face of both random and constant challenges that we call stressors. And these stressors can be external or internal, as we'll see. Stress can generate a visceral response within our body. Now, stress responses are considered a good thing because they allow us to monitor our environment, but also allow us to adapt to our environment. And it's only when stress becomes more of a chronic concern that we have to worry. Stress can be different for different people, as we know. And stress can even be different for the same person at different times. In many circumstances, what was once stress can become something that we've learned to cope with. So if you think back to times where you really stressed over certain circumstances, and then now under the same circumstance you're not stressed, it's because you've adapted, you've learned to cope. Homeostasis in this case is really our balance between demands, which are the stress, which is stress or the stressors, and your coping ability. A stressor can be defined as really any stimuli that can trigger our alarm reaction. And this can be either physiological or psychogenic in terms of cause. So let's say you decide to climb Mount Everest. Now, as you climb this mountain, you're reaching higher altitude. This higher altitude causes less oxygen availability and therefore less consumption. And this stresses your body physiologically. This event, though, is really considered a predictable event because of what we know about the changes in altitude and oxygen availability. So if you were to climb Mount Everest, you'd be aware that oxygen consumption would be reduced. So again, that's physiologic. Psychogenic stress, though, is internally driven. What is stressful for one person will be very different than what is stressful for another, especially when it comes to psychogenic stress. So as an example, if you're not used to traveling on the 401, then you might be more stressed about this event should you have to travel on it, compared to someone like myself who does it every day and really doesn't even have to think about it. The way that we respond to stress is with what is called the General Adaptation Syndrome, or GAS for short. General Adaptation Syndrome is a non-specific response to stressors. In other words, it can happen, or it does happen nearly the same way all of the time. And it can be acute, or it can be chronic. Acute is generally okay. It's our body becoming aware of what's going on and trying to cope or trying to adapt. But when it becomes chronic, this is problematic and oftentimes related to chronic disease. So our inability to cope then can lead to chronic problems, and this chronic stress can lead to such events as a heart attack, for example. General adaptation syndrome is induced by a variety of different stressors, and there are 3 different stages that are involved. The alarm stage and the adaptation stage are generally good. This again is our body monitoring and adapting. But if you have extensive resistance, it can lead to exhaustion, and exhaustion can lead to disease. On the right here in this lower image of the brain, you can see a little bit of the neuroanatomy. And what we're going to be focusing on for a few moments on this slide is our limbic system. And our limbic system is this complex system of nerves and networks within the brain. It involves several areas near the edge of our cerebral cortex that are concerned with things such as instinct and mood. Our limbic system controls basic emotions such as fear, pleasure, anger. And it also controls drives such as hunger, sex, dominance, and even care of offspring. And what's interesting about the limbic system and the features of the limbic system is it's present in really all species. We have similar reactions to these drives and these basic emotions. So what you can see from this lower image here of the brain is the interconnectedness of the limbic system throughout all different areas of the brain, which control all different emotions, behaviors, etc. The figure at the top demonstrates neural recognition and response to real as well as predicted stressors. And as we progress through this lecture, we're going to be addressing many of the different areas within this flow chart. So at the end of the lecture, come back to this flow chart and you'll see some of the overlap. On this slide, you can see a list of various different diseases, which are really known to be impacted or influenced to varying degrees by stress, whether it's physiological or psychological or psychogenic, as we spoke about earlier. And what we're going to be doing throughout a little bit of this lecture, but at certain points throughout the rest of Pathophysiology 1 and 2, is we're going to be addressing these diseases, many of these diseases. And sometimes we'll relate it to stress. And we'll see in today's lecture how stress can have quite an impact on various systems in our body. On this slide, we have 3 different scenarios. So relating to A and B and C. Starting at the top. In healthy individuals, let's say a person has a stressful life event. They can either experience ineffective coping, which can lead to significant stress. So we're going in this direction. Significant stress response. And this stress response can lead to exhaustion because there's been what we could say so much resistance that we end up with distress or illness. Or this individual can experience effective coping mechanisms. And this will allow for really a transient effect of the stress. It's pretty easy to return back to what we know of as homeostasis. On the bottom left, we can see some of the potential effects in symptomatic individuals. So here up at the top we had healthy individuals, now we're looking at symptomatic. Now if all of a sudden these individuals have some sort of stressful life event that comes up, if they have developed effective coping mechanisms, then there might be little or no effect on their current symptoms, whatever they may be. Symptoms of an illness, for example. But if these same individuals that have some sort of illness, so they're considered symptomatic, they have ineffective coping mechanisms, it can lead to exacerbation of their illness, an illness that maybe you make no link to stress. Stress can impact it. So coping is really important. So once again, if someone is already ill with some disease, it can be made worse or it can remain the same, all depending on how they cope with the same stressor. On the far right, you can see the potential effects during in symptomatic individuals during medical treatment. Now, if these people, these symptomatic individuals that have some sort of illness, if they're going to receive a treatment, so starting at the bottom, some sort of treatment for their medical illness, it could potentially decrease the symptoms that they're having, whatever those symptoms of that illness may be. So we have the inhibition here, reduction in symptoms. But if these same individuals perceive the treatment that they're getting as being a stressor in itself, then it can actually make things worse than they were from the very beginning. So treatment has actually made things far worse than it would better. So to summarize this concept, it's really outlining the dynamics in a clinical setting in which the diagnosis of a serious illness and then the subsequent medical interventions may be perceived as a stressful challenge. And if they're perceived as a stressful challenge, they could have potentially detrimental influence on the physical outcome. So a very, very important concept to consider. Whenever we're exposed to stressors, we will have 2 main responses that occur. It's either going to be a sympathetic response, or we could say a neurological response, or it's going to be an endocrine response. Stimulation of the sympathetic system will affect many different organs in the body. And there will also be secondary effects from the adrenal medulla. So we're looking down here at sympathetic, secondary effects of the adrenal medulla. And as we'll see later, both epinephrine and norepinephrine are involved. So I want you to think of the adrenal medulla as really being almost an extension of our sympathetic nervous system. Recall that the sympathetic nervous system is actually an extension of the ANS, or the autonomic nervous system. involved in your fight or flight response. The endocrine response, on the other hand, first I should say that the sympathetic response is very fast. But with the endocrine response, this is a lot slower, and it's going to be mediated by the hypothalamus. Thinking back to normal anatomy. Remember, we have the hypothalamus as part of the brain, and then we have the pituitary gland as an extension off that has both an anterior and a posterior lobe, which both secrete the anterior lobe secretes a handful of hormones, and so does the posterior lobe. It secretes hormones that the hypothalamus has produced. And so during a stress response, the hypothalamus is going to release what's called corticotropin-releasing hormone. Remember back to anatomy and physiology, we talked about how the hypothalamus produces hormones that the posterior pituitary gland will store, but it also produces releasing and inhibiting hormones that will signal certain events of the anterior pituitary lobe. So the hypothalamus in a stressful situation will release corticotropin-releasing hormone that the hypothalamus produced. And this hormone will stimulate the anterior pituitary gland to release one of its hormones, which is adrenocorticotropic hormone, or ACTH. And this hormone will then stimulate the adrenal cortex. So we're talking about the cortex, whereas we were really talking about the medulla when we spoke about the sympathetic nervous system. It will stimulate the cortex of the adrenal gland. Remember, the adrenal gland sits on top of the kidney. And this will cause the adrenal cortex to release glucocorticoids. And very specifically, cortisol is the one that is relevant here. And so this will be released in the blood, and this is going to have a much slower effect, but a more steady effect in the body. So this image here demonstrates the alarm stage in the response to stress. Epinephrine is released by activation of the sympathetic nervous system, as introduced on the last slide, through stimulation of the adrenal gland, but in particular, the adrenal medulla. And this happens within seconds. It's a very, very quick response. So you can see here a nerve signal. So this is a nervous response, stimulating the adrenal medulla to release epinephrine, which is also known as adrenaline. And this is going to cause such events as an increase in your heart rate, an increase in your breathing rate, and an increase in your blood sugar. And all of these events will prepare you for a stressful situation, prepare your body to be able to run in the event that that's what you need to do. Now, an increase in blood sugar. You might wonder, why do we have an increase in blood sugar? Well, remember, glucose is such a huge energy source in our body, and our muscles require glucose really for efficient production of adenosine triphosphate, or ATP, which we'll use quickly in stressful situations. So putting more sugar or glucose into our blood will make it more available for all of the muscles in our body that need it during this stressful event. Now, if this stressful response lasts, then the release of cortisol will occur by the adrenal cortex. So remember, we have the release of ACTH, which will stimulate the adrenal cortex to release, in particular, cortisol, which is a glucocorticoid. And this is something that's going to happen, again, if the stress response lasts, so within minutes to hours after the event, if it's still occurring. And one of the main events that cortisol will do is it will stimulate the liver to release glucose. So there's a process called glycogenolysis, and this is the process by which glycogen, which is the primary carbohydrate stored in the liver, also stored in muscle cells, it'll be broken down into glucose. And what this will do is it will provide immediate energy and maintain blood glucose levels during this stressful situation. Ultimately, what we're trying to do is prepare the body really for a run response, so it's able to respond in a fight or flight situation. So So a little bit more on the sympathetic response. When our sympathetic nervous system is activated, as we know, the adrenal medulla will be activated and you'll get the release of these hormones, and it will cause some events such as increasing the strength and contraction of the heart. So you're pumping out more blood to your body because it needs it during this event. You'll also see an increase in blood pressure, and this is also an important event during a fight or flight response. And so here are some of the events that occur that lead to an increase in blood pressure. So you'll get contraction of the smooth muscle within arterioles, you'll get vasoconstriction to contribute to an increase in blood pressure, increased peripheral resistance. Remember these terms from normal anatomy and physiology. And on this slide, on the image on the right, you don't need to know all of the details here, but I want you to note the involvement of the sympathetic chain during a sympathetic nervous system response. And you can see here all that's involved. There is so much that's involved with what seems like such a simple reaction. So another slide on the sympathetic nervous system and how fast it is, immediate in terms of its response to stress. And what exactly is the stimuli? Well, think of activities that start with E. Exercise, excitement, emergency situations, and embarrassment are all events that will activate our sympathetic nervous system. And fear would be in here as well, and that kind of puts you into the emergency category. When we experience a stressor, there's going to be reduced blood flow to visceral organs. And so reduced blood flow to non-essential organs, in other words, organs that aren't essential during that particular event. So instead, blood is going to be shunted to the more important organs for that event, like your heart, your lungs, and your skeletal muscle. You'll also see, so there's that increase in blood flow to skeletal muscle. There will also be an increase in changes in the cardiovascular system, so increase in cardiac output, blood pressure, heart rate. Breathing rate will become more rapid and more deep. And the purpose of that is to get more oxygen into your body and then be able to get rid of that increased carbon dioxide production. Your skin will appear cold and sweaty. Goosebumps will even be seen. Pupils will start to dilate and take in more of the visual stimuli in the area so that you're more aware of what's going on. So dilating is taking in more, allows you to take in even more information. And then, of course, as we already know, blood glucose levels will increase in order to feed the muscles in the body that are going to need it in that circumstance. And we call that hyperglycemia, so increase in the amount of glucose found in the blood. For the most part, I've already talked about what's on this slide, but remember that the more intermediate response to stress that happens within minutes to hours is stimulation of the endocrine system. Now via, and this is a new term, the hypothalamic-pituitary axis. This stimulation, as we know, is going to cause the release of corticotropin-releasing hormone from the hypothalamus. And so you can see that here. And we know that that is then going to stimulate the anterior pituitary gland to release adrenocorticotropic hormone. So that's now we have listed on this couple different areas here. And then we know that ACTH will travel in your blood to reach, or so within your systemic circulation, to the adrenal gland found on top of the kidney, specifically to the cortex of the adrenal gland, and it will cause the release of cortisol. And cortisol is that hormone that can have various metabolic effects within our body. And it's probably one that you've heard of even outside of the classes that you've taken here at school. So this increase in the amount of cortisol in the blood can have negative effects over time. So you've probably heard that too much cortisol in the body can lead to even things such as weight gain. But what's more relevant for a course such as this is that the increase in amount of cortisol in the blood over time can lead to immunosuppression, which can increase your risk of infection and also antibody response within the body. Now, if someone has a disorder of the adrenal glands or the pituitary gland or of the hypothalamus, as you can imagine, this might affect or alter your stress response. So anything that affects your adrenal gland can really overall cause loss of this general adaptation syndrome. And like most mechanisms in our body, remember we will constantly have feedback. And that feedback is really important because you want to be able to inhibit or enhance the situation in terms of hormone release, depending on what exactly is happening. Do we need to continue to have this stressful event and release these hormones, or can we stop the secretion of these hormones because the person has adapted and coped properly? So this is a very busy diagram, and I'll go through with what you need to be aware of, and some of this is already reviewed from what we've discussed. So a stressor. Some sort of stressor can have two responses. We're going to have a really quick response that we know is that sympathetic nervous system response. We also know that we can have a slower response where the hypothalamus is going to release corticotropin-releasing hormone, which will then have various effects. So we spoke about the anterior pituitary releasing adrenocorticotropic hormone in order to produce cortisol. And you can see some of the effects on here that cortisol has. Cortisol has the ability to increase blood pressure and cardiac output. It has the ability to impact our immune system as well, as we've talked about. So I'd like you to be aware of this here and how cortisol can cause changes in inflammation, and it can either act as an anti-inflammatory or pro-inflammatory hormone. And as we spoke about on the last slide, it can cause immunosuppression, which can be very concerning long term. Our sympathetic nervous system, we talked about the release of norepinephrine and epinephrine, and I want you to be aware of some of the events that occur when norepinephrine and epinephrine are circulating through your body. Remember, these come from the adrenal medulla. So some events that we'll see: increased blood pressure, increased pupil dilation, goosebumps, so that's called piloerection. And I mentioned these on one of our previous slides already, so this is quite a review. Bronchodilation will occur in order to improve increase your breathing. We'll see increased sweat gland activation, in particular in the armpits and the palms is a normal response. We talked about the increase in arterial smooth muscle contraction to ultimately have an effect on blood pressure. We talked about increased force and rate of cardiac contraction. We talked also about increase in cardiac output. Some other organs that are affected here are the liver and the pancreas. And this has to do with the blood glucose levels. So with our liver, we know that we can increase the amount of glucose found in the blood in this response. The pancreas, we know, produces hormones such as insulin and glucagon, which have opposite effect or antagonistic effects. So if we decrease insulin, it means that we're going to leave more glucose in the blood and uptake less by organs that don't need it. Increased glucagon means that we're going to produce more glucose, but also allow glycogen to be broken down in places such as the liver, where we are, at the end of the day, increasing our blood glucose levels. And where you see instances talking about breakdown of fat and increase in levels of amino acids, these are also energy sources, remembering back to what our major molecules of life are in the body that we use for energy, but glucose is that primary source. But our body can also use lipids and proteins for energy as well when it's needed. So here's that increase in blood glucose, with that main purpose being to allow your muscle cells to be able to get as much as they need in order to produce the energy to function and allow you to fight or flight from a situation. So let's look at how the stress response affects the immune response. Something that's known more now and much less in the past is that there's this interrelationship between the nervous system, our endocrine system, and our immune system. And it's not that just one affects the other. You can see that they really do have an impact all throughout. And so stress, we know, can impact the nervous system, but then we get this immune system reaction and endocrine system reaction. So it's a very dynamic situation. Now looking over here on this diagram on the right, cortisol, this can be released during acute stress, as we've talked about, and it can be beneficial because it promotes healing and repair and adaptation, provided that it's in the short term. So some of the effects that we'll see from cortisol is in terms of its impact on immunity. is that cortisol can act to suppress the activity of Th cells. So remember, T cells, we have helper T cells. And you can see this here is representing suppression. So cortisol acts to suppress the activity of Th cells, and this leads to an overall decrease in what we know of as our innate immunity. Cortisol can also have an effect on overall inflammatory responses, but the other important point I wanted to point out to you is that cortisol has the ability to stimulate the helper T cells too, or Th2 cells. And what this ends up doing, so the opposite effect, now we have stimulation of Th2 cells and reduction or inhibition of Th1 cells. And so we end up with this reduction in cellular or innate immunity and this increase in our humoral immunity or our adaptive immunity. And epinephrine and norepinephrine actually have very similar effects as cortisol has on our immunity. So this effect, where there is a decrease in Th1 cells but an increase in Th2 cells, is sometimes called the Th1 Th2 shift. Okay, Th1 Th2 shift. Individuals that experience this shift are more likely to experience such events such as allergic reactions, infections, maybe temporary worsening of pre-existing, let's say, an autoimmune disorder that they have. So arthritis, where it flares up. And so this shift, this imbalance that we're seeing is a very unique event or a very specialized event that can cause detrimental results in individuals that experience. And so we're really talking about a situation where chronic stress ends up causing problems with our immunity. So that might sound like it's concerning to you because it can be very difficult to control stress, and stress can become chronic very easily. So if this is something that you're thinking that you're worried about, well, you need to control your stress by methods such as whether it's meditation, yoga, breathing. Exercise is a huge way of controlling stress, and that will help you kind of get out of that chronic stress state where your immunity can be affected. And I'm sure you've experienced instances where you've been stressed for a long period of time and you find that you're getting sick all of the time. So combating stress when you identify it can help get you, maybe keep you in the acute stage, but not into the chronic. And because of the integration of these three systems that you can see here on the left of your screen, sometimes this is referred to as psychoneuroimmunology. It's really a whole new area of study because of the involvement of our nervous system, our endocrine system, and our immune system. So again, psychoneuroimmunology. Here's some of the long-term effects that stress can have on various systems in our body, so cardiovascular, endocrine, immune system, and gastrointestinal. So remember that our cardiovascular system can be impacted quite quickly with increases in cardiovascular function. We talked about things such as blood pressure, heart rate, and contractility. But continued increase in these functions, so if what we just said is happening in an acute response, that's okay, but if it's happening chronically, it has long-term effects and can lead to coronary artery disease, arterial hypertension, stroke, and arrhythmias, so irregular heartbeats. Now, what's really interesting about things such as coronary artery disease is the cause can actually be an increase in lipolysis. So you can go back to one of our previous slides where we talked about the breakdown of fat, where you can have an increase in the amount of free fatty acids as a response to stress into your blood. And so what can happen then is these free fatty acids can end up depositing themselves in arteries, getting stuck, forming plaques, leading to atherosclerosis, and then possibly even coronary artery disease, which is very concerning. This is where the arteries, remember the coronary arteries that supply the heart muscle itself, can be blocked. And over time, this could lead to a heart attack or something similar. Now, with continued stimulation of the endocrine system, if you have these elevated levels of blood glucose for too long, so hyperglycemia for a long period of time due to the chronic stress, This can lead to type 2 diabetes. The cortisol response can also lead to a decrease in follicle-stimulating hormone and luteinizing hormone. And this can lead to what's called secondary amenorrhea, where a female will stop menstruating. So no menstruation. And this is not a problem with your reproductive system, but rather changes in hormones because of constant high levels of cortisol affecting other hormones. Now, in terms of an immune response or your immunity being affected, prolonged stress can lead to immunosuppression, as we've already talked about, which can lead to secondary immunodeficiency, with stress being really the primary disorder. And lastly, stress can affect the gastrointestinal tract by causing things such as ulcers, inflammatory bowel disease, diarrhea, and you may have even experienced some of this yourself during stressful events. The ulcers and the inflammatory bowel disease are really caused by the pro-inflammatory effects. If you look back to that very big flow chart a few slides back, it talks about pro-inflammatory effects from cortisol, and that can lead to the ulcers and inflammatory bowel disease, as mentioned. And so these are examples of some of the disorders that can arise from really longer term stress. So with that being said, if you are feeling stressed and you're finding that it is affecting your everyday life, just make sure that you understand that not only does the university offer many resources that could help you, but there are so many other resources out there, and all you have to do is ask. And if you're kind of lost, then feel free to contact me anytime. Thank you for listening to today's lecture. Bye for now.